So we'll be discussing how do you find your topic after you've selected a population, intervention, and control from your area of interest. How do you know that your topic is good and you can do research on it? So the steps that you can follow in order to finalize your topic include background search, preliminary search for reviews, preliminary search for original articles, and finally you consult an expert. You must gain knowledge about your topic. You do background search on it by going through a few narrative reviews in order to know the anatomy, pathology, physiology, biochemistry related to your topic. For example, the mode of action of that drug, the severity or stages of a disease, whether it is mild, moderate, or severe, being addressed in your field, and the duration of treatment. Then you do a preliminary search for reviews. You look for the systematic reviews, narrative reviews, and meta analysis on your topic. If you don't find one on your topic, you're good to go. Search for your topic with population and intervention using Boolean operator and with systematic review filter on PubMed and, for example, MI and PCI. Then you do preliminary search for original articles using the RCT filter. Before you finalize your topic, it is best to identify 3 or 4 studies you would definitely include in your studies. You go through these studies in detail to see the outcomes being assessed, the population being followed, and intervention that is being used. It will also help you in finalizing your inclusion and exclusion criteria that you can apply on other studies or other articles that you're including in your research. Then you consult an expert, get guidance from an expert in the field with experience or knowledge of systematic review and meta-analysis so they can guide you better in the field of research. They will be the best judge of your area of interest and the clinical relevance of your topic and its impact. Otherwise, it is possible that you might end up doing research on a discontinued treatment or compare treatments that are redundant. An example to make you understand this more clearly. So, from the area of interest, for example, cardiology, nephrology, oncology, you went finally with cardiology. And from amongst the other diseases in this field, you went with heart failure. Read up on articles on the treatment and uh, the mechanism of heart failure and everything, and you find out that there is medical treatment and device therapy. And you finally see the gap between the triple and quadruple regimens that are used in different hospitals. So you finalize your topic to be quadruple therapy versus triple therapy as guideline-directed medical treatment in heart failure with reduced ejection fraction patients. A systematic review and meta-analysis. Then what steps you should follow in order to refine your topic? You do a background search. You will learn about the heart failure, its risk factors, treatment options, mode of action of drugs used and their classes, their doses, and efficacy. Then you do a preliminary search for review articles. You run a PubMed search for your topic with population and intervention with systematic review filtering. In case you find a review on your topic, you don't have to forsake your topic entirely. You can modify it to make it different. You can specify your population. You can change it from adult to pediatric population, or you can specify the stage of your disease or the severity of your disease. You can also modify the intervention. You can change a class of drug to a specific drug in that class, or you can use a class instead of a specific drug. You can modify the control, outcome, and study design as well. How does this apply to your heart failure topic? So in heart failure topic, instead of adult population only, you went with elderly population specifically, that is above 65 years, or with patients who have CKD or diabetes. Then you change your intervention from quadruple therapy to specific SGLT2 inhibitors. Control, you change from triple therapy without MRA or triple therapy without ARNI, making it more specific. Then you change your outcome from all-cause mortality to heart failure rehospitalization. So the study design can be changed from cohort studies to RCTs. And then you do a preliminary search for original articles on PubMed using the same previously mentioned criteria for triple therapy and heart failure with reduced ejection fraction. Then you read up on those articles to get an idea of the outcomes being mentioned in several studies or the inclusion and exclusion criteria that you would want to set up. Then you consult an expert. And in your case, a cardiologist was consulted who advised to proceed with the topic as several centers use quadruple therapy, whereas others continue with triple therapy. So, an optimal guideline directed medical treatment strategy remains to be established. And so you can proceed with your topic. That is all. I hope you understand how do you refine your topic after you selected an area of interest. Thank you.